Magandang araw sa inyong lahat and welcome to our fourth pre-recorded lecture for the subject Clinical Practicum 101B. And this time, we will be having a summary of the third stage of labor. I am Dr. Leigh Reburon and I am your instructor. In the third stage of labor, we need to remove the placenta completely or else we risk the patient to develop postpartum bleeding. So before this happens, the placenta and the uterus should separate completely before the placenta is expelled. Always remember that we, midwives, are responsible for watchfully waiting for the signs of placental separation and expulsion to prevent obstetrical problems. Remember that we have at least 30 minutes to deliver the placenta after the delivery of the child, so we should not forcefully pull the placenta out or else we risk the patient to develop retained placental fragment or postpartum hemorrhage. So what are the signs of placental separation? Number 1 is the sudden gushing of blood. Number 2 is the lengthening of the cord. And number 3 is the uterus becomes globular or what we call the Calkins sign. So remember to wait for those 3 signs of placental separation before attempting to expel the placenta. Active management of the third stage of labor is effective when it comes to reducing postpartum hemorrhage by more than 60%. And there is also a sequential physiologic change in the third stage of labor, and they are as follows. Number 1, the placenta needs to separate first from the uterus, and then the placenta will need to descend to the lower uterine segment. After that, the expulsion of the placenta will take place, and lastly, we need to control the bleeding by stimulating the uterus to contract. So those are the sequential physiologic changes that occur on the third stage of labor. The common complications that we see on the third stage of labor are retained placenta, postpartum hemorrhage, perineal laceration, and even uterine inversion. Always remember that to prevent all these things from happening, we need to follow the active management of the third stage of labor. And these steps are always in order. So what are the steps in AMTSL? Number 1 is we always check for the second baby. After the delivery of the first child, always make sure to check the uterus for the presence of the second baby before proceeding to number 2. So if you have already checked that there is no second baby, next is you give or administer uterotonic drugs if there is no second baby. And these drugs are number 1, misoprostol, number 2, oxytocin, and number 3, ethyl ergomethrine maleate. All of these drugs stimulate the uterus to contract. So we give that drug after we check if there is no second baby. Number 3 is we deliver the placenta by applying controlled cord traction. So what do we mean by this? We pull gently the umbilical cord downward so as to deliver the placenta. Number 4 is we also give uterine massage to the patient after the delivery of the placenta. Why do we need to give uterine massage? Remember that we need the uterus to contract so that the point wherein the placenta and uterus were connected will also close. Because if the uterus remains relaxed, there will be active bleeding and that will cause postpartum hemorrhage. After you deliver the placenta, we follow step 5, which is examining the placenta for its completeness. Always remember that according to Adele Piliteri, there is 16 to 18 cotyledons, and other books, they say 15 to 20 cotyledons. No matter the number, always make sure to check the edges of the placenta if there are cuts, tears, or incomplete segment. And if there are incomplete segment, report immediately to the doctor so that he or she can perform manual evacuation of the placenta. And lastly, we also examine for postpartum laceration and active bleeding. So you just have to inspect the vagina of the mother for the presence of cuts or lacerations which are consequence to vaginal delivery. You also have to check for the linens and the soiled underpads of the patient to check if the patient is experiencing active bleeding. So remember that the uterotonic drugs like oxytocin, ergometrin, and misoprostol are always used to control bleeding, but ergometrin and oxytocin are always kept in the refrigerator so that they will not be destroyed. Next, we also administer drugs within 1 minute after the delivery of the baby. So within the first minutes after the delivery of the baby, we should already give the uterotonic drugs if we have already checked that the second baby is not present. Remember that a well-contracted uterus is felt as firm and hard and well delineated with no active vaginal bleeding. So you can always feel for the abdomen of the mother to check if the uterus is firm and hard. Matigas po dapat yung nafe-feel natin dito. And when we say well delineated, makikita mo din mismo sa abdomen na nagbubukol siya. It forms a globular shape. So that is a sign of a well-contracted uterus, and a well-contracted uterus is a uterus with no active bleeding. Now, we have to massage the uterus to prevent postpartum complication. Remember that after the delivery of the placenta, we want the uterus to be fully contracted, and you, as the midwife, should always ask the patient to massage and monitor the uterus. Always remember that partnership and cooperation is necessary to prevent these common complications. So you tell the mother, Mother, pakimassage po yung inyong uterus at sabihin sa akin kung nafe-feel mong maraming lumalabas na dugo at nafe-feel mo na yung mattress mo ay malambot. Dapat, Mother, it is firm and hard, and dapat nafe-feel mong well delineated or bumubukol siya sa lower abdomen. So those are the things that you should say to the patient to watchfully look for the signs of relaxed uterus. Also, we give IV or intravenous fluids to the patient and refer the patient to another health facility if, number 1, we see missed placental lobe or retained placenta. So pag nakikita po natin na kulang yung placenta or may mga tear or hindi natin na-deliver completely yung placenta, you give IV to the patient and prepare for referral. Number 2, you also give IV and refer the patient to another health facility if you see that there is a relaxed or enlarged soft uterus. So kahit massage ka na ng massage, nagbigay ka na ng uterotonic drugs, nagbigay ka na ng ice compress, pero relaxed pa rin yung uterus mo, or uterus ng nanay, I should say, refer the patient immediately and give the patient IV. Next, you also refer the patient to another health facility and give IV if you see continuous bleeding even after giving uterotonic drugs and uterine massage. So, dapat nagbibigay ka na din ng IV sa pasyente natin kung continuous pa rin yung bleeding niya at relaxed pa rin yung uterus niya, because the patient might need blood transfusion. So, like I said, kailangan magbigay ng IV para may daanan yung blood transfusion natin if ever the doctor will order blood transfusion. Now, we proceed to the common complications of the third stage of labor. We have your retained placenta. So when we say retained placenta, it is the failure to pass the placenta within the 30 minutes after the delivery of the fetus. So kung yung pasyente mo nahihirapang ilabas yung placenta, kunwari 45 minutes na ang nakakaraan, that is already considered a retained placenta or a failure to pass the placenta within the first 30 minutes after delivery. We also have what we call retained placental fragments. These are incomplete delivery of the placenta. Maaaring lumabas si placenta pero may mga naiwang cotyledon or parts na napunit or missing segments of the placenta. Those are what we call retained placental fragments. So in case that we see patients like this, what do we do? Number 1, do not tug the cord. Kunwari ayaw lumabas ng placenta, 45 minutes mo na siyang dinedeliver. Do not tug the cord. Do not do counter traction. Kasi sa kakahila mo, baka mas mapunit yung placenta. Number 2 is you also always inspect the placenta for completeness. Just in case na deliver mo si placenta pero nahirapan ka, remember to always inspect for placental completeness so that you will know if there are retained placental fragments or none. Number 3 is do not apply pressure on the abdomen, especially if the abdomen is relaxed. Kasi pag nagpo-push ka downward sa abdomen mo habang nakarelax si uterus, tendency is pwedeng mag-invert si uterus. Lumabas din siya kasama ni placenta. So do not apply pressure on the abdomen if you have retained placenta. Number 4 is prepare the patient for immediate referral. Kung matagal nang dinedeliver mo si placenta pero hindi mo siya matanggal or meron kang nakitang retained placental fragments, it's time that we refer the patient immediately. And the doctor will perform manual extraction of placenta, or you can also do the manual extraction of placenta if you have proper training. Remember that retained placenta and retained placental fragments are both dangerous because they can lead to postpartum hemorrhage or bleeding, and in the long run, they can also lead to relaxation of the uterus and uterine infection. So we have to do our responsibility if we have patients with retained placenta and retained placental fragments. Number 2 common complication of the third stage of labor is what we call uterine inversion. In Ilocano, bumabaliktad or agbalbaliktad nga matres or butilaw. The uterus everts or inverts or turns inside out and is visible in the vaginal area. So makikita mo nang sumisilip po si uterus sa vagina ni mother. Meaning, lumabas po si uterus from the vagina, bumaliktad. Now, always remember that uterine inversion is caused by forceful tugging of the umbilical cord. Kakahila mo sa umbilical cord, lumabas si placenta, lumabas din si uterus. This is also caused by delivering the placenta in a relaxed uterus. We have to check the uterus that it is contracting before we try to attempt to deliver the placenta, or else pag nakarelax po si uterus at pinilit mong ilabas si placenta, lalabas din si uterus. Number 3, uterine inversion is also caused by delivering the placenta without proper separation to the uterus. Like I said a while ago, you have to wait for the 3 signs of placental separation, which are sudden gushing of blood, the umbilical cord lengthens, and the uterus becomes globular. So kahit kung hindi mo pa nakita yung mga signs na yon of placental separation, do not pull the umbilical cord because the placenta has not yet separated from the uterus. Pero kung ikaw ay medyo subtle at ginawa mo pa rin yun even without waiting for the signs of placental separation, the patient may suffer from uterine inversion. Now, what are the signs and symptoms of uterine inversion? Number 1 is that the uterus is visible in the vagina. So makikita mo sa may vaginal area ng mother, there is an organ there, a muscle or a mass na nakalabas. Okay? That is the uterus. Next, there is also massive bleeding. Bakit? Kasi nga nakalabas si uterus, kaya magbe-bleeding yon. And lastly, there is also rapid decrease in blood pressure. So when you check the BP of the patient is having hypotension. Those are the signs of uterine inversion. So what is our midwifery responsibility if ever we have patients who suffer from uterine inversion? Number 1 is we report immediately to the doctor. Bakit? Kasi the doctor may push back the uterus inside. The doctor will try to relocate the uterus by pushing it inside the vagina. Ibabalik niya doon sa loob. We are not legally allowed to do this procedure. So report immediately to the doctor so that the doctor can perform this procedure. Aside from that, we also have to prepare uterotonic drugs. Always remember that uterine inversion is most commonly caused by a relaxed uterus. Lumabas si uterus kasi hindi siya nakakontract, nakarelax lang siya. So what do? We give uterotonic drugs para po yung nakarelax na uterus ay mag-contract And then we also provide uterine massage because uterine massage is also known to be effective when it comes to stimulating the uterus to contract. We also insert IVF to the patient or your dextrose or suero if you may because the patient might need blood transfusion. Remember that patients with uterine inversion usually suffer from too much blood loss. So the patient might need blood transfusion. And lastly, kung late tayong ginawa lang lahat ng to or the doctor cannot perform anything anymore, we prepare for possible vaginal hysterectomy. So anong ibig sabihin nito? The uterus may be removed by the doctor through the vagina. So we do not want that to happen. So if you see patients with uterine inversion, report immediately, give uterotonic drugs, provide abdominal massage, insert IVF, and prepare for blood transfusion para hindi po tayo humantong sa vaginal hysterectomy. Next, common complication of the third stage of labor is your excessive bleeding or what we call postpartum hemorrhage. Excessive bleeding is defined as a blood loss of more than 500 ml during vaginal delivery. Remember that it's normal for a woman to lose 300 to 500 ml of blood during normal spontaneous delivery. Pero pag mas marami na sa 500 ml yung kanyang nawalang dugo, that is already considered excessive bleeding. So how do we determine excessive bleeding? Paano natin malalaman, sir, kung masyado ng maraming dugo ang nawala? We determine it through weighing the soiled drapes and linens. Ikikilo natin yung mga nagamit niyang diaper na maraming dugo and then we subtract it by the weight of the linens or underpads na wala pang dugo. Alright. Now, what are the signs and symptoms of excessive bleeding? Number 1, the uterus appears relaxed. Always remember that a relaxed uterus is a bleeding uterus. Okay? So, yan yung unang makikita nating sign if there is excessive bleeding. Number 2, we also look for signs of hypovolemic shock. Bakit hypovolemic? Kasi konti na lang yung dugo ng pasyente. Therefore, mag-iiba din yung kanyang vital signs. And what are the changes in the vital signs for the patient with hypovolemic shock? Ito po yun. Number 1 is hypotension. Number 2 is tachypnea or fast respiration. Number 3 is tachycardia or fast pulse rate. And number 4 is hypothermia. So yung clue ko, pag sinabing hypovolemic shock is hypo-tachy-tachy-hypo. Hypotension, tachycardia, tachypnea, hypothermia. Those are the signs of hypovolemic shock. I repeat, hypo-tachy-tachy-hypo. Another sign of excessive bleeding is what we call cold clammy skin. So pag finil mo yung skin ng pasyente, maginaw siya or meron siyang respiration or malamig yung kanyang skin. The patient may also experience dizziness and lightheadedness. Why? Kasi konti na lang po yung dugong pumupunta sa kanyang brain kaya siya nakaka-feel ng pagkahilo or lightheadedness. And the patient may also have a urine output that is less than 30 ml per hour. So yung pasyente, konti na lang din yung kanyang naiihi. Bakit? Kasi konti na lang yung dugong pumupunta sa kanyang kidneys. So those are the signs and symptoms of excessive bleeding. Now, what are our midwifery responsibilities when we have patients with excessive bleeding? Number 1 is provide abdominal massage. We want to massage the patient's uterus because we want it to contract. Number 2 is we apply cold compress to the lower abdomen. Remember that cold compress promotes vasoconstriction at pag nag-constrict po yung inyong mga muscles, it will also create contraction on the uterus, thereby producing or reducing bleeding. Next, we also initiate breastfeeding immediately. Remember that when the child breastfeeds or sucks or stimulates the nipple, there is a release of oxytocin, and your oxytocin will also stimulate the uterus to contract, thereby preventing excessive bleeding. Next, we also have to prepare the patient for transfer if the condition worsens. So kung hindi natin ma-manage ito ng tayo-tayo lang, we have to ask other members of the healthcare team from other hospitals by transferring the patient. Next, we also have to insert IV fluids to the patient because the patient might need possible blood transfusion. We also have to raise the lower extremities to address the signs and symptoms of shock. Pag yung pasyente po nakahiga, lagyan natin ng dalawang unan yung kanyang paa so that it will improve the circulation of the blood. Next, we also give uterotonic drugs. Remember that a relaxed uterus is a bleeding uterus, and we want to stop the bleeding by stimulating the uterus to contract. Therefore, we can give uterotonic drugs to stimulate the uterus to contract to prevent excessive bleeding. And lastly, we have to inspect for laceration kasi minsan hindi po nanggagaling sa uterus yung bleeding ng pasyenteng katatapos manganak. Saan nanggagaling? It may be from the presence of vaginal lacerations as consequence to normal spontaneous delivery. So you have to check for the vulva, tignan mo kung may mga sugat-sugat doon, and you have to suture them so that it will stop the excessive bleeding. Next, we also have another common complication on the third stage of labor which we call post-partum laceration. Ito po yung mga sugat-sugat or tearing of the vulva as consequence to vaginal delivery, especially for patients na malaki yung anak pero maliliit yung kanilang puwerta. They are prone to having post-partum lacerations. Always remember that we have two types of post-partum laceration according to position or location. So, yung mga sugat na nakikita natin on the upper half of the vagina, these are what we call the anterior lacerations. And yung mga anterior lacerations, they usually involve labia majora, labia minora, anterior vagina, the urethra kung saan ka umiihi, or even the clitoris. Pwedeng makakita ka din doon ng lacerations. Those are what we call anterior lacerations or yung mga sugat na nakikita natin on the upper half of the vagina. We also have what we call post-partum lacerations, and they are lacerations that are seen on the lower half of the vagina. They involve the posterior vaginal wall, the perineal muscles, and even the anus or the rectum. So, pag lower half po ang sugat sa vagina, we call them posterior lacerations. Now, we also have the different types of laceration according to degree of involvement. If the laceration only involves the skin or vaginal mucosa, or the laceration is very shallow or superficial in nature, that is what we call first-degree laceration. These types of laceration will not need treatment or suturing. Why? Because these lacerations can heal on their own. Bakit? Kasi mababaw lang naman po yung sugat. Next type is second-degree laceration, which involves the skin, the vaginal mucosa, but may also involve the forceps and the perineal muscles. So pag involved na po yung muscles kasi, remember that inside the muscle, we have blood vessels. And these blood vessels will now lead to bleeding. So the second-degree laceration will require suturing or repair so that we can close the damaged blood vessels in order for us to prevent vaginal bleeding. Now, if the laceration involves the skin, the vaginal mucosa, the forceps, the perineal muscles, and the anal sphincter, tatandaan nyo ha, anal sphincter, it will now require suturing and repair, and that is considered the third-degree laceration. These types of laceration will also require antibiotic therapy. Bakit po? Kasi yung sugat umabot po kung saan na andoon si anal sphincter. Remember that your anus is full of microorganisms. Therefore, the patient should be given antibiotic therapy to prevent infection. The last type of laceration that we have involves the skin, the vaginal mucosa, forceps, muscles, not just the anal sphincter, but also the rectum. rectum. So pati po yung mismong daanan ng tae ng pasyente or the rectum is already involved in the 4th degree laceration. Now, this type of laceration requires suturing, repair, and even antibiotic therapy. Kasi nga po, again, involved na yung rectum, which is the passageway of the fecal matter. And alam naman natin na yung feces has a lot of microorganisms that can lead to infection. So those are the types of lacerations according to the degree of involvement. And that concludes the summary of the 3rd stage of labor. I hope you enjoyed the meeting as much as I did. You will be given a few days to review for your test, and a 20-item exam will be posted on Edmodo, which will be covering lessons 1 to 4. Again, keep safe, be healthy, and stay alive. Maraming salamat for listening.